Hi Mama and Mama to be, Dr. Nikki, back with another video about pelvic floor stretching. So some of y'all reached out to me about pelvic floor stretching, why it's important. I talk a lot about that in the first pelvic floor stretching video, the internal one. So check that one out if you really want to know the whys. I'll review it a little bit in this one too. But some people are not comfortable using their finger to go into their vagina to stretch their pelvic floor, which I totally get. And so I wanted to offer you another way to stretch your pelvic floor muscles without having to touch it, touch yourself down there. So that is using a towel roll. So what you'll basically do, I've got a towel here, and you can take a towel and roll it up. I recommend either a washcloth or like a bathroom hand towel. This is not one of those, but you basically want to create a log, kind of like this, a towel roll. You can put some rubber bands around it if that helps keep it in the roll. And then what you're going to do is you're going to sit on it. So put it on a chair or something, and then you're actually going to sit on it. You want it to be narrow enough to where it goes in between your two sit bones. So you don't want it to be like a saddle. You don't want it to cover the whole perineum or the whole bottom of your pelvis. You actually want it to go up into your pelvic floor in between the sit bones. So everybody's pelvis is different. So the size of the towel roll is going to be different compared to the next person. I didn't say that right. The size of your towel roll that's going to be effective for stretching your pelvic floor might be different than the size of the towel roll that will be effective at stretching my pelvic floor. So play with different towels that you have around the house. Each try a washcloth, try a pillowcase, try a hand towel, try a kitchen towel, and just see, roll them up and sit on them on a hard-ish surface and see, does it go directly right up in between your two sit bones? Because that's where the pelvic floor is, between your two sit bones and in between your tailbone and your pubic bone. So that whole area, kind of where a pad would sit, is where you want this towel roll to be. So once you have your towel roll of appropriate size for your body, you're gonna sit on it lengthwise. So like that, like a saddle. And you're gonna allow your body to go into that towel roll. It might be tender at first, especially if you're postpartum and you had some tearing or an episiotomy. Be very, very, very gentle with yourself. More is not better, ever. So once you're sitting on that towel roll, I want you to play with really relaxing into it. Really let that towel roll come up into your perineum. Allow it to stretch those fibers that really doesn't ever get stretched. And relax and hang out there for maybe a minute or so, and then get up. Give everything a break, shake it out, and then sit back down on the towel roll. You should notice after 2 or 3 times that it's not as sensitive or it's not as tender. That's excellent. A progression of that would be, once you sit down on the towel roll and it's the appropriate size for you, you can rock your body forward and backward to get different angles of that pelvic floor. So usually, rocking forward helps get the front of the pelvic floor closer to the bladder, a little more stretched, and then rocking backwards towards the tailbone puts more pressure around the anal opening, so that helps a lot with constipation or tailbone pain. And then you can come back to neutral. You can also go side to side and get the inside of those sit bones, the muscles where they attach right there. That can be a very tender point, and that can contribute to some hip and or pelvic pain. So playing with this and finding where those tender spots are, using the towel roll as your guide, as your helper, can be a very effective way to stretch and massage the pelvic floor muscles. So why would you do something like that? Well, if you are pregnant and you are planning for a natural birth, this can be an excellent way to help stretch those muscles out and provide more ease as the baby is coming down the birth canal. This is also excellent postpartum. Again, 4 to 6 weeks after you deliver. Do not do this before that because everything is still very much in a healing phase. But usually once you've been cleared by your doctor around that 6-week mark, if you're still having pain, tailbone pain, constipation, bladder leakage, it could be because the muscles have tightened up in response to the pain and the trauma that childbirth is or was. And this can be an effective way to slowly ease into stretching and massaging those muscles externally without you having to touch anything down there. So those are the two biggest implications that I have seen this to be very effective. And if they're not effective, then you can check out the other video about internal pelvic floor stretching and give it a go. So if you have any other questions, email me. There's also some free general postpartum guides and information in the links below if you are curious and want to empower yourself with knowledge. So thanks for sharing your time with me, and I'll see you in the next video.